Thanks for being with us. Let me ask you, COVID in general, where are we now? The R number is rising, albeit very slowly. Cases are increasing again, albeit very slowly. The picture appears essentially quite flat. It feels like we've got control of the virus now.
Yes, it's flat but high is what I'd say. So the R value, the reproduction rate is hovering around 1. If it goes up, we'll have more cases. If it goes down, we'll be getting past the pandemic. And as you say, the cases, I mean, we're still seeing a large number on a daily basis. So somewhere around 30,000 cases a day, which is significantly high. But the difference is those cases are not translating through to significant amounts of hospital admissions and thankfully fatalities, deaths in those affected. So it's a good sign in the sense that our vaccines are really effective, and we can see that. We can see that they're preventing. They're effective about over 90%, whichever vaccine you've had, in hospitalisations or deaths.
So what we know is that the autumn wave hasn't materialised yet. That much we can say for some surety, can't we? And we know it's definitely autumn. You can go outside and feel the chill wind. But despite that colder weather, despite children being back at school for over a month now, we haven't had that huge surge in cases. Can we say yet that we're now unlikely to get a substantial new autumn or winter wave?
So I think there's a mixed picture there. Actually, we have seen a surge upwards, which you could classify as a surge. But what we're seeing is that not coming down again the other side. It's a fairly static high. The reason that's important is because as we enter winter, as you just said, we'll have colder weather, darker nights, people will accumulate inside. We need to keep ventilating, doing all those things, because flu is also upon us, as are other respiratory viruses. So I think where our attention is going now is to keep COVID in mind. Our vaccines are effective whilst the Delta variant dominates. But actually, we need to turn our attention to other winter viruses, which perhaps we haven't seen so much because of those protective behaviours last winter. And the most obvious one is flu. And I'm sure your listeners will be very aware of the fact that we have the biggest flu campaign we have ever launched this winter, just this week.
I want to get on to flu. Just a couple of quick more questions on COVID. Is it fair to say, though, that though cases are high, 30 to 40,000, they're not up to the 60, 70,000 mark that we certainly saw, for example, at the start of the third lockdown? Therefore, can we all now rest assured go about our daily lives knowing now with some confidence we're not going to have to go into lockdown this winter?
I don't think you can never say 100%, but I would say that while the Delta variant dominates, we know that our vaccines are effective, and I think it's highly unlikely. You'll be aware there is a plan B from government, which is held there in check so that all planning is in place. But if we look internationally across the world, actually, wherever we're seeing new variants at the moment, Delta is predominating. We're still keeping an eye on a couple of them. So I think it's looking positive, but I would never say 100%.
Okay, I wouldn't ever force you to either. That would be a path down which no decent scientist or medic would ever go. But let me ask you about a couple other issues. Mask usage, I've detected, is well down, and I would say the significant minority are now using them unless it's mandatory. Only a few people on my train this morning, for example, had one. It's not mandatory on the train. Is that okay with you? Do you mind people wearing masks a whole load less than they did perhaps a month or two ago?
So I don't know how representative your train carriage was, because we do monitor mask wearing. And in fact, what we've seen is that for older people, it's reasonably high and it's stabilised out. It is true in younger people that the usage tends to be reducing. And of course, it is actually that age group, it's the younger teenager group who are predominantly infected at the moment. So I don't think it's true to say it's going completely. I would want to encourage it broadly for two reasons. It not only helps prevent the spread of COVID, but other respiratory viruses, and that will include flu as well. But actually, we've also found through the pandemic that many people are quite anxious about getting back out into the open. And so it just makes perfect sense in enclosed environments where there's poor ventilation, and train carriages are absolutely, a classic environment where people will huddle in together for short periods of time, that people should continue to wear face covering. So I always do that if I go into a shop or if I'm on a train, then I maintain it both to prevent respiratory infection but also to ensure people feel comfortable.
All right, don't dump your mask yet.
Exactly.
I don't know if you saw any scenes at Tory Party conference last week. Poor old Isabel and I had to spend the entirety of last week there, as we did the week before at Labour, and almost nobody was wearing a mask. In fact, we had the Prime Minister's speech, a large room, people packed in quite tightly, hundreds of people in the room listening to the Prime Minister's speech. I didn't see a single person in that hall wearing a mask. Does that sort of sight trouble you?
I think for the conferences like that, there will have been a very significant amount of preparation and precaution, and people attending conferences such as that will have been checked to ensure that they are not infectious when they go in. So I think everybody's been advised, and the same for me. I'm not wearing.
Dr. Harries, sorry to interrupt, but they weren't. We weren't checked. Neither Isabel nor I had our vaccination status checked. There were 0 checks.
So I think people are advised to ensure that they are not infectious when they go in. I think this is where we are hitting the balance between personal choice and responsibility and how we work in communities generally. So I'm not wearing a face covering, for example, in my normal workday environment. I try and stay back from people. I ensure that I'm not infectious as best as I can. During my time, I do wear a face covering where I'm required to. I live in Wales, is my residence, and in fact, face coverings in shops and other places, communal places, are compulsory here, and I think that's fine.
Okay, I won't push any more of that. It's slightly unfair if you asked to slag off the government because you're a government employee. Let me ask you something else. Do you still see a benefit in people working from home, a health benefit, a benefit to the country in terms of controlling coronavirus?
Well, I think what the pandemic has done is opened up a whole new conversation about the balance of well-being and work, not just in terms of health protection and respiratory infections, but actually about what is the right balance between home working and working, and that will vary by individuals. And I think we've seen a number of organisations actually surveying their own employees to ask them what is best for them. Now, in some organisations, it won't work. So, for example, for some colleagues working in health protection in emergency response, that clearly is not an opportunity. For others, it works well. So I don't think there is a simple balanced answer. I would say, however, that I think particularly as we approach the flu season, for example, whereas people traditionally in the UK have sort of grin and borne their infectious disease and then gone into work and spread it around, I'm hoping that as we go through winter, people, when they are symptomatic, will generally recognise that and stay away and be supported to do so.
Okay, but to put it another way, if the nation said, do you know what, we're all going to go back to work tomorrow, it's going to be exactly like it was pre-pandemic, we don't see any need for anyone to stay at home any longer at all, would you be comfortable with that?
I don't think it fits with what I've just said before, and I don't think it's responding to how individuals want to view their work. I mean, there are other advantages, quite apart from the health protection issues, of encouraging and supporting individuals to retain their jobs and interests. But I mean,
just on the
certainly, I
health
think
protection matter,
if everybody returned immediately to work without due consideration, then I think it's likely we would see more cases over a short period of time, depending on whether they were wearing face coverings, whether they were taking appropriate precautions. But of course, most people are protected now. So even people who are doubly vaccinated are becoming infected. They are not becoming seriously ill, and they are not dying in the way that we saw previously.
Let's talk about winter flu. We know a large wave of it is probably coming. We also know that there's a lot less immunity, don't we? Because we didn't have much of a flu season last year, largely because we were all locked up. Now, I know that worries you. You've just mentioned that. There are predictions that winter deaths from flu, which are roughly 20,000 a year, could be double or even triple this year rather. Is that something that you're aware of and you think is likely?
I think I'm concerned for a number of reasons. Our research suggests that people are not aware. A lot of people, 25%, are not aware you can actually die from flu. I think people underestimate the significance of that. We also know that a large number of people don't understand that COVID and flu could be co-circulating at the same time. And exactly as you've alluded to, we've had a winter where we've had almost no flu cases in this country. And so this will be the first test where effectively people are out and about and flu is co-circulating or likely to be with COVID. Those estimates of numbers, there's a figure of 60,000 deaths floating around, which is the upper limit of a report from the Academy of Medical Royal Sciences. And it is a scenario, it's a model, it is a plausible model, but it's the upper limit. And we would normally have, on average, about 11,000 deaths from flu each year. So I think putting those two together, and also the fact that there is an increased demand on hospitals as we recover from people who perhaps haven't sought care during the pandemic, we're particularly concerned to protect our health services as well, obviously, as individual lives.
That's very interesting. That level of flu going through the community, when you add that to the current level of cases, COVID hospitalisations, I think it's roughly 600-700 hospitalisations a day now, and that is also remaining consistent. How much stress are hospitals going to come under during the toughest days, December, January? And is there still a chance they could become overloaded again?
Well, winter is always a tricky time for hospitals anyway, regardless. We always do winter planning. It's monitored very, very carefully, and various different mutual support mechanisms are put in to ensure that patients can be treated or staffing can move between different areas where necessary. But the whole point of the flu campaign that we've launched and for the COVID booster campaign is to ensure that people are maximally protected, and that outcome doesn't actually eventualise. So it's something we monitor. I think it's manageable. But I think the other thing is we need to recognise that staff have worked right through the pandemic and into this winter. So we have an accumulation of circumstances which make it particularly tricky. But the clear message is there are 35 million free flu jabs out there. If you're eligible for one, please go and get it.
And that is indeed your point, isn't it? Because if people don't take their flu jabs, a lot of people don't, then it is entirely likely we could see hospital beds put under severe pressure.
I think there is an uncertainty. So what we're doing is planning, as you would expect, for the worst. And they've said the 60,000 is an upper figure. There is quite a high degree of uncertainty this year. So we've missed a year. To often find a strain of flu will jump a year. We estimate it. We work with WHO guidelines and then JCVI decisions based on usually what's been seen in the southern hemisphere from their winter that will have just passed. But of course, no area has had sufficient cases really to understand what the likely strains will be. And so although we have 4 different strains in each flu vaccine that you're given to kind of cover, it's a wide tool, we can't guarantee what that will be. And it's possible, because we've had this gap, we will have a multi-strain season. So instead of having one particular flu virus strain, which is dominant, we may see a couple at the same time.
Let me move on to the vaccination programme, because we were the world leader in vaccinations. We started it, we were doing incredibly well. We've slipped down that table, particularly amongst 18 to 29-year-olds who you've said are those getting most infected with the 10 to 19-year-olds as well. Just 65% of 18 to 19-year-olds, 18 to 29-year-olds rather, have had a first dose. A third, in other words, are still refusing. And those numbers seem to be remaining quite constant. In other words, young people just aren't coming forward to get jabbed anymore. Does this bother you, or does it no longer matter as much with everyone else in the community now double and even triple jabbed?
So I feel very strongly that we should not be suggesting that young people are not paying attention to the flu vaccination. They were the last groups to be called forward. The school vaccination programme for the younger teenagers is actually that group. In the 18-year-olds and young adults, actually, rates have come down significantly. We know people going back to university, for example, have been really conscientious about how they're behaving and what they're doing. And we've seen that when we've had an outbreak in a university before. So I'm afraid I don't hold with saying young people are not paying attention and supporting our response to COVID. It is true that if you look at the curve, if you like, of vaccine uptake, it's an S-shaped curve. We have very fast adopters, we have the bulk of people, and then we'll have the less confident coming through at the tail end. that curve is broadly similar for young people as it is for older. And obviously for the younger age group, the 11 to 15-year-olds who have just been brought into the school programme, that programme is only just kicking off. So by all means, ask me again in a month or two's time. But this is quite new for that age group. And I think we need to give them time to get used to the idea they're eligible and make their own choices.
Okay, let's talk about that 12 to 15-year-old group then, the latest. The vaccine rollout for them is incredibly slow. So only 1 in 10 12 to 15-year-olds have been vaccinated so far. You're down to roughly sort of 20 to 30,000 doses a day for them. But at the same time, huge amounts of people are getting third jabs, third boosters. So 470,000 people in the last week got a booster jab. Just 70,000 12 to 15-year-olds did. Why are you prioritising older people over 12 to 15-year-olds?
So the two programs are not being prioritised separately; they're running separately. So I think, and they are entirely different beasts, if you like. So it is still, even with double vaccinated individuals, it is still the elderly who are most at risk of serious illness and death. And so we would encourage them to come forward for their booster. Amongst younger children, the teenagers, those who have specific underlying conditions, who are clinically vulnerable, will already have been offered their vaccine, so they should be covered and prioritised the same way. But the point I really want to reinforce is a school's vaccination programme for a new vaccine is a very, very different thing to just calling in adults who can go in, make their own decision and leave a mass vaccination centre. In schools, children need to have appropriate safeguarding in place. They need to have appropriate sign-off from their parents or guardians. Teachers need to feel comfortable that it's fitting into the working environment of the school. And schools have been absolutely fabulous in supporting the response to COVID. So again, in a normal school year for flu vaccine so far, the uptake, and it was the best we had last year, was around 61%. This was at the end of the flu season. So actually, we're making pretty good strides. I mean, I'd obviously want it to go as fast as it possibly can.
But it's, I mean, just on the speed, the government had a target of hitting all 12 to 15-year-olds being vaccinated, a target by half term. There's zero chance of that happening. My kids' school, for example, I know the date when they've just announced that they're all going to get vaccinated. It's on the 12th of November. This thing is moving slowly, and that is surely not a great thing.
So obviously, I'd want the programme to move as quickly as possible, but it also needs to be very informed so that children and their parents have time to make those decisions properly, and that all the appropriate safeguarding is in place. But yes, we'd obviously want to encourage it to move as quickly as possible, and I think that's what NHS colleagues and those commissioned services are trying to do.
Final question for me, because Isabel wants to ask you something as well. We know that new variants are the great threat, don't we? That has always been the concern. The Delta response is weaker from the vaccine than others, but it's still manageable, as we've been discussing. I understand there are estimates that range from a 5% likelihood of a new variant emerging that will be resistant to the vaccines we currently have, up to 50% likelihood of one emerging that will be resistant. What do you think the reality is? How worried should we really be on a brand new variant?
So I'm not going to put a figure on that at all. I think I would be very unwise.
You've seen them.
Yeah, but I would be very unwise to. Some people think there will be none. What I would say is, when we're looking, I think the important thing is we're monitoring. In it, where we've looked across the world, even at variants which we have been concerned about, and we're currently, for example, looking particularly at the Mu variant at the moment, where you see a surge in Delta, it seems to be dominating other variants, and a number of variants have now become extinct. They come off the worry list, if you like. Now, while that continues, I think we can feel reasonably confident. So the two things we need to do generally are, one, monitor very carefully new variants arising. We do that particularly where there's high replication rates, or particularly in individuals who are very severely debilitated, so hospital patients, for example. And then number two, be ready to go with any appropriate vaccination to have a very rapid run through between a new variant, which really is causing concern, and a potentially new vaccine.
Aren't you worried about the emergence of further variants around the world, given that the UK and lots of other countries have prioritised domestic vaccination programmes and booster programmes above donating more vaccines to developing countries?
Well, I mean, this opens up the question. I'm a public health physician and absolutely recognise the importance. This is a global issue. This isn't a domestic issue. But there are many ways of supporting that response. So, for example, in the UK, we have the new variant assessment platform where we are using, we've now a leading expert in genomic sequencing and using some of that capacity to support understanding of the potential for new variants to arise in countries abroad, not just domestically. I think the other thing is, of course, that the AstraZeneca vaccine, which was built here in the UK, is actually one which is really easy to administer in many of the countries which perhaps are less easy to roll out a vaccine program with some more complex implementation processes. So it's not simply just the availability of the vaccine, it's whether you can roll it out. And I think, yes, strongly support that we have vaccination across the world. It's all of our responsibility, not just the UK. But we've done some leading work here as well. And the AstraZeneca vaccine is a really important contribution to global coverage as well.